When it comes to patient care, what's your core philosophy or your core beliefs or approach to helping patients?
I think my approach to patient care is really to think about each case as an individual person, meaning that each time I see a patient, I'm trying to give them my focus for that, whether it's 5 minutes or whether it's a half an hour. And in that, I guess I approach medicine as well as life, thinking that each person has value in their current situation, so their illness or their condition or their concerns are really valid every visit and deserve my full attention. So I try and approach each case that way and try and be very open-minded, trying to understand what the individual themselves is like and what they're seeking in terms of their care, and then come at it from the other angle of all my expertise and training to try and give them my best advice in terms of how their exam is and what diagnoses they likely have and how we should best manage them within the context of their own goals. So that's how I work day to day, and in our field we see multiple patients throughout the day, and they're all going to come from a different background, a different part of the country or world, with different desires for how they'd like to be treated. So it's a great challenge, and it's really fun. It's very satisfying day in and day out to work that way, and probably what I enjoy most about the field. Yeah.
What is that first patient experience like in terms of when they walk in and see you in the diagnosis process, and then how it varies in terms of the time that it takes?
Sure. So in dermatology, we see a wide range of diagnoses. From very, very common conditions like warts, benign moles, sunspots, things that are very simple to diagnose visually. And from that to more complicated diagnoses that are long-standing skin rashes that may be lifelong from birth on, or have developed in adulthood but have lasted years and years and years, in which case there may be a very long backstory with the patient's history and symptoms and evolution of their disease. So with those two different full ends of the spectrum, from very simple and quick diagnoses to very complicated care scenarios, our visits can range in time depending on the need for the patient. So some simple cases, patients might come in for a single lesion they'd like us to look at, and if that lesion looks benign, that may be a very quick visit where we can reassure a patient and there's not much more that we need to do or discuss. And then on the other end of the spectrum, there may be a complicated case that we have to review a lot of records before we even see the patient or after seeing the patient, and our discussion in terms of asking the patient histories on how they're affected by their condition might take 15, 20, 30 minutes. And that time will incorporate a very thorough skin exam maybe for that patient. So it's a big range, and one of the advantages to a visual field like dermatology is that we can use our eyes and our mind to make a diagnosis rather quickly sometimes, and shift our focus at times then just in terms of what the right care is for that individual. And so we have the advantage that we don't always need a lot of tests, although sometimes we do need blood work, or we may take skin samples for evaluation to help better reach a diagnosis.
So sometimes even a short diagnosis doesn't mean that you're it just varies, and you can focus on the care management part.
Correct. Yeah. So some diagnoses we will call. Some diagnoses are very simple from an expert dermatologist, and what's confusing sometimes is that a patient may have seen their primary care provider or family practice doctor or urgent care clinic, maybe all three, and at different points of a care plan, and may have, for a rash, may have not gotten the right diagnosis, and for a dermatologist who may have a lot of experience seeing the exact same presentation over and over again, that may be a relatively simple diagnosis for us, and so the reaching the correct answer might take just only a few minutes, and so then we can focus on the care plan. And that can be a little confusing for patients sometimes to understand, well, why did it take so long to get the right diagnosis and you were able to do it so quickly? And it really has to do with experience and training and teaching and having seen many cases the same way in the past. Yeah.
Is there any particular case or patient that's a story that you've helped that just really you felt like you really made a difference and does that stand in your mind?
Yeah, I mean, I think I like to think that those cases happen frequently. That we're able to make a difference in people's lives on a routine basis, and for we don't like to say that certain diagnoses are simple or a case is common and that is of less value than something that's more complicated. So, just as a common example, I think we make a routine difference in patients' lives on a day-to-day basis with common diagnoses like acne that a lot of teenagers or young adults can be pretty affected by and very bothered by in terms of their appearance or the psychosocial impact that disease might have on them, or to other common diagnoses like eczema, where patients can be extremely symptomatic and itchy and not sleeping well, and so we can see sort of immediate benefit. And it's really wonderful to see those patients back when we do have success, just to get the appreciation that their lives are improved by the care we provide. So kind of tangible examples, but not a specific patient.
Yeah,
Mm-hmm.
yeah. I mean, it sounds like beyond the technical part or the medical part, you're really helping them with confidence in the way that they're able to experience, show up in their lives.
I think the goal across the board in medicine is to improve quality of life, and sometimes we can't reach a cure in all conditions in medicine, unfortunately, but the goal in those cases is always to try and improve how the patient is affected by that condition. And if we can achieve that goal in a great way or even in a partial way, that can be a win. And that's very satisfying. I hope that it's appreciated from a patient perspective, because we certainly love seeing that from a provider standpoint, to see patients come back and have seen improvement in their condition and feeling better, less itchy, sleeping better, feeling better about themselves and how they look. Yeah.
Yeah. A couple more quick questions. What are some of the concerns that patients have, or reservations that they have from actually going and seeing a professional like yourself?
Yeah, I would say one common reservation might be feeling uncomfortable about getting a full skin exam. We appreciate the fact that it's uncomfortable to expose parts of your skin to a complete stranger who's a physician, and it is an important part of our exam because skin is a visible organ that in order for us to examine it appropriately, we need to look people over. And most of the time when you're a new patient, we recommend doing a full skin check to look at moles, because even if you come in for a wart on your thumb, you may have a suspicious mole on your back that you're unaware of. And so a lot of the concerns people have is, well, why do I need to get a full skin exam, or I'm uncomfortable getting undressed, and hopefully we can alleviate concern for patients. turn